Good afternoon, everyone. How's your book festival going? Fantastic. 20 years. Congratulations to the organizers of the book festival. Can everybody hear me? Okay, great. I will let the audio technician know. If there's any problems, he can take care of it. Thank you so much. So let's do a show of hands before we introduce our panel. How many people work or used to work in global health? Wonderful. How many people are just curious about global health? How many people have no idea what global health is? Okay, we got one, great. I think it's important to understand who our audience is so we can serve you best in the next hour with our questions and answers, and then hopefully your questions and the answers that come. So you have the bios of your speakers in your programs. You can take a look and read all of their wonderful many accomplishments. I will introduce briefly our panelists today. We'll start at the other end. We'll start with Patrick O'Carroll, President and CEO of the Task Force for Global Health. Hello, Patrick. We have Kashif Ijaz, Vice President for Health Programs at the Carter Center here. Joyce Sepinu, Senior Director of Global Health Programs at CARE USA. And Brandon Talley, Chief Program and Innovation Officer at the CDC Foundation. And I think just these four people here today are an illustration of the extraordinary influence Atlanta has on global health around the world. Not just one of these organizations, but they're just four of numerous organizations here in Atlanta that are transforming lives, saving lives, and ultimately protecting Americans through their work as in global health. One of my favorite questions to ask any organization, what is your origin story? So I would love for all of you to start, we'll start with Kashif. What is your organization's origin story? Why are you in Atlanta?
But first of all, thank you for the audience for being here, but most importantly for holding this event, and thank you to Task Force for Global Health and to Rickey for moderating this. This is indeed a very important question and a great panel over here, which basically tells us that when you look at Atlanta, it is the hub for the global health. When you look at the various organizations that are actually here. Well, our story, the Carter Center, was established by former President and Mrs. Carter, the former First Lady, back in 1982, and their goal was to wage peace, fight disease, and build hope. And so we actually have health programs as well as peace programs at the Carter Center. On the health side, we are basically focused on disease eradication and elimination efforts, which are focused on neglected tropical diseases. Not all of them, but the ones which we focus on is kidney worm eradication, elimination of river blindness, elimination of trachoma, lymphatic filariasis, schistosomiasis, and then we also do work on mental health, which had always been the baby for Mrs. Carter, and she was way ahead of her times when she thought about mental health and caregiving. Just to give you an example in our successes in terms of the disease eradication elimination work, when we started to work on kidney worm eradication back in 1986, and we are here where we were talking with just Dr. Fahey, and Bill Fahey was obviously famed for the smallpox eradication work. And when the health side of the Carter Center got established, Bill Fahey actually had a big part to play in that. And that's when he told President Carter and said, you should probably focus on disease eradication elimination efforts, just because if you can eradicate smallpox, you can also eliminate eradicated diseases as well, which I call is the holy grail for public health, or the final frontier, because once a disease is eradicated or eliminated, you don't have to worry about it, generally speaking. So when we started on kidney worm eradication, back in 1986, there were estimated 3.5 million cases in more than 20 countries, about 22 countries around the globe. And as of right now, there are only 4 human cases on a planet of 8 billion people. So when you start thinking about it, and this is a disease which is going to be the only second disease after smallpox to get eradicated, and this disease does not actually have any vaccine, it does not actually have any therapeutic or medication to prevent it. It's all about behavior change, treating the source of the water, but most importantly, working with the people at the end of the road and empowering them. The second thing I would mention is, we've done similar kind of work on river blindness, and we've actually been able to eliminate river blindness in about 4 countries in South America, and we're just at the last 35,000 population. It's a tough area, at the border of Brazil and southern Venezuela. But we're still, working on that. Trachoma is the same way. We are slowly and steadily eliminating that around the globe. On the mental health side, which was Mrs. Carter's baby, people started talking about mental health after COVID. Although it had always been important, but the most important thing was to reduce stigma around mental illness. And it's okay if you have mental illness to go and get help. And in Georgia, we've been working with the legislator over here, and there was a Mental Health Parity Act which was passed 2 years ago. And we are among the very few states in the union which actually have such an act. And now we are moving towards its implementation. In addition to that, we are also doing work on climate change and its impact on health, how mental health can work in a cross-cutting way with other infectious diseases, and how peace and health programs can work together, specifically related to how to advance health security and get access to areas and countries which are inaccessible because of violence, community insecurity, and so on and so forth. So I'll just stop here.
Thank you. Brendan.
Thanks, and I'd also like to extend my thanks to Dr. O'Carroll for inviting us and for the task force for hosting this event. It's amazing to see the room filled today, and thanks everyone for being here. I'm going to extend your question. How many people have heard about the CDC Foundation? Oh, wow, okay. I feel like I normally go into rooms, including when I go to see my parents who don't entirely know the difference between the CDC and the CDC Foundation. So it's good to see that the room recognizes the organization, so that's great. So I feel like Bill Foege's name is one there's gonna be a through line for many of our organizations. Bill Foege and several of the other former CDC directors recognized that there are some gaps in what CDC could do in terms of speed during emergency responses and a variety of other opportunities. And really the intersection of where the public and the private meets together, where there's philanthropic opportunities and private sector opportunities, because there's really not been any public health crisis or public health issue that's been solved by government alone. And through luminaries like Bill Foege, they went to Congress in the mid-90s, set up Congress, created us in the mid-90s to actually build public-private partnerships, not just in service to public health, but to the public's health more generally. So we have a footprint both here in the U.S. as well as globally. As we were talking about today, we're here to talk about global health. When I started with the foundation in 2007, I worked on what at that time was really our first large global health project, global tobacco control. And since then, our portfolio has expanded pretty broadly: maternal health, drowning, improving civil registration and vital statistics, particularly birth and death records across the world. I'm proud to say we've worked in over 100 countries as an organization. Our typical footprint operates in about 25 of them. In mixing both the infectious disease space as well as the chronic disease with a real and opportunities around emergency response. I think about Ebola, Zika, particularly. We've had significant work that we've done with CDC as well as ministries of health and national governments and community-based organizations, civil society, other partners on the ground. So really happy to be here. I'll pass it on.
Hi everyone. It's on. As Rickey said, my name is Joyce and I come from CARE. I want to say thank you to the task force for global health for getting us here together on this important topic. What's our story? CARE International, CARE US. So this is an organization that got founded in 1945. And in 1945, it was after the World War II, when there were lots of war-torn zones in Europe. So 22 charities came together and said, this is what we're going to do. We're going to put together packages and send across to people who are in the most need in those countries. And these packages included food items and several other life-saving items, and we labeled them care packages. And this is how the organization started, by sending these packages across the globe. And so this went on for a while, and by the late 1960s, CARE had evolved from being a relief organization to a global development leader. And as our work evolved, we moved from being in just several countries to many other countries, and we started to launch different programs across the globe. Our health programs were launched in Egypt, Honduras, Pakistan, and several other countries, and we started to look at disease outbreak, maternal and child health, and went into all kinds of partnerships to make sure that we are improving access to health for the populations that need the most. And one of the other things, as we evolved as an organization, we started to get into countries like Asia. And in Asia, I'll give an example. Our work in maternal and child health halved maternal mortality in that country and improved health systems. And this is a population of about 120 million people, and bringing down their maternal health with the support of the Gates Foundation was really, really huge. And we've had support from other partners and donors, including the American government. As we speak, we are in 121 countries and working in different sectors. We're in about 6 sectors across the globe. And we are very proud of the partnerships, but also very proud of the impact we are making across the globe. And so really happy to be here to share and elevate the importance of global health in this community. The part that I missed is in 1993, we moved our headquarters from New York City and moved to Atlanta. And this is the community that embodies our values, values of generosity, values of community, and support for each other. And since then, we've been here for 30 years, and we've grown into the organization that we are today. And we're really proud of being in this community. So thank you.
Hi, everybody. Thank you all for coming. Our organization also was founded by Dr. Bill Foege, and many people don't realize this, but it all began when he was bitten by a radioactive spider.
No.
It's part of our... Sorry, I was really hoping that joke wouldn't bomb. This is the concept of origin stories, but the way it got started, Bill was already doing so many amazing things. He was a key to coming up with the final strategy that eradicated smallpox from our planet, from our species. It's an amazing accomplishment, many, many thousands of people involved, but Bill was instrumental in getting there. He had been a former director of CDC, formerly important in directing the Carter Center. He's just an incredible person, well known internationally. And as a result, he was the person that was sought out by a group of very far-seeing people. It was the director of the WHO, the director of UNICEF, the director of the UN Development Program, a senior person at Rockefeller, very top people around the world. All had recognized that we were not making the progress we needed to make in vaccinating the world's children. At that time, roughly 1 in 5 children were getting the vaccines they needed through their childhood. That's terrible. 80% not getting a perfectly proven life-saving intervention. And none of them were happy about the progress they were making. And they wanted to do things better, but the leader of WHO had one idea of how to do things, and the leader of UNICEF had a very different idea. And they were not working well together, but to their credit, they knew that had to be fixed. And they came to Bill Foege as a person respected by all parties and said, Bill, could you bring us together and help us find a path forward that would make progress? And they did get together. Bill said, sure, I'm happy to help. Originally, the plan was not to form a task force. It was to bring this group together, a group of about 20 or so people, and think this through and find a better path forward for collaboration. And a key part of that was working with all of them to pick a goal that would be highly motivational for all of them, that they would all hold themselves to, independent of the people they worked for. They would hold themselves to this collective goal and then systematically march down the road to get to that goal. What they came up with was 80%. They didn't know they could ever get to 100%. It wasn't enough to double it. That 80%, they thought we could, if we really did everything we could do, we might get there. And incredibly, after all these years of getting to 20%, it was just about, 6 years later, they got to 80% of the world's children getting at least one vaccine. So it's an incredible achievement. That alone would have been worth the effort. But to keep it going, they said, Bill, we'd really like you to put together a task force to keep this marching down the road. And so he did. And the task force had 3 people in it. It was just a group that would serve as a catalyst to all the other brilliant groups of brilliant people that were working on it, and funders who were putting millions of dollars into it to help it march toward that goal. And that was to be its one and only project. But 3 years into that project, Bill was approached by then the CEO of Merck, a guy named Roy Vagelos. And Merck had been doing work with its product, which we now know as ivermectin, and testing in the lab to see what diseases that might be useful for treating, that they could sell the product to treat those diseases. And they found that it was incredibly powerful at treating a disease called onchocerciasis, which you mentioned, Kasia, which is river blindness. But the people with river blindness will never be able to pay for this drug, no matter how inexpensive we made it. These are people really at the end of the road. And so Roy came to him and said, I will give you as much ivermectin as you need for as long as you need it to treat everyone in the world that has onchocerciasis until we get this under control. It's an incredible offer. And to Merck's terrific credit, I don't know if anyone here is from Merck, but through multiple CEOs, they have kept that pledge. And to this day, it is now our longest running, in fact, I think the world's longest running pharmacophilanthropy, where they donate a drug rebranded as Mectizan, but it's actually ivermectin, for the sole purpose of distribution to treat people who have river blindness. And it's been eliminated in certain countries, many countries in the Americas. It was finally completely eliminated in one country, Africa, and many other countries are on their way to elimination. It's a dreadful disease. It causes painful itching and disfigurement and ultimately blindness. So it's the kind of thing that Bill couldn't say no to. So now there are 2 projects at the task force. And fast forward now, we have about 20 projects in health system strengthening, in immunization still, and also in disease elimination. And what unites them all is Bill's original facilitative approach to getting things done. If you ask what binds all the programs together at the task force, it's this idea of a catalytic role to bring organizations and people together to take on huge global health challenges. So you'll often find a half dozen people working on the project here at the task force, and hundreds of partners around the room, including, by the way, the Carter Center, but many other organizations you've heard of, like Sight Savers International and other organizations called implementing partners, working with countries to get these medicines delivered where they're needed and to monitor the development of diseases and to get capacities built, for example, in disease detection and investigation in countries all over the world. So we have this wide-ranging set of projects that all began with Bill's idea that if you bring people together, form a goal together, and then collectively hold yourself accountable to it and march toward that goal and be responsible and measure on your way, you can achieve almost anything. And that underlies pretty much everything we do at the task force. So thank you.
I'm going to pick up on that concept of there being a collaboration in an ecosystem that you all are working in. As Brandon said, no government has ever single-handedly eradicated a disease. It's required partners with Merck, partners with organizations and NGOs like the Carter Center. How do each of your organizations benefit from being part of the ecosystem here in Atlanta?
So maybe I'll go on this one. When you talk about global health is truly global, and by that what I mean is it's multi-sectoral. No one can work in global health in isolation. And that requires exactly what you just said. It's partnership, collaboration, coordination, and that's key to it. And it's between multiple sectors: public sector, private sector, as well as academia, and then most importantly with the countries when you're looking at from a global standpoint with the ministries of health. And I always say this because this is our ethos at the Carter Center: working with the people at the end of the road. And these are the communities which are sort of at the end of the road when nobody wants to go, there's no infrastructure. And President Carter used to say, and because we work with neglected tropical disease, his quote was, "There are no neglected diseases, it's just neglected people." And that's where we actually work with directly, empower them, work with the community health workers when you're looking at these various diseases and make them a true partner in the ownership of how to eliminate or eradicate a disease. When you talk about Atlanta, as we were talking at the very beginning, Atlanta is the global hub of global health. When you start thinking about it, you have CDC here, we have CDC Foundation, CARE, Task Force for Global Health, the Carter Center, and then when you start looking at academic institutions, there's Emory, there is Georgia State University, there's Morehouse, there's also UGA, and so all of these universities actually train people, younger people, to come and work in public health, whether it's domestic or global health. And they actually intern with a lot of our organizations around this table as well. And so I would just say that for global health, you really need to think multi-sectoral partnerships, and most importantly, all this work, since we are an international NGO, would not be possible without donors, whether they're technical partners, only donors, or even philanthropic organizations. Thanks.
I keep noticing that Bill Fagie's watching us from right over there, and I feel like he's here in spirit with us as we're talking through this. As we were talking through the origin story, something that really struck me is as far as our individual organizations reach, they're all still very complementary to each other. And I think that shows how much work actually has to be done in the global health space. It's like the job is never finished. Even when we make amazing achievements like eradicating smallpox, there's always something else and we just have to look at COVID. There's always something else around the corner that's going to require the type of partnerships across organizations, like the individual organizations here that have built a network of partners. Not only in Atlanta, it's kind of truly like a global health hub with the institutions that you mentioned and many others that are probably represented in the room. Our reach really extends beyond just this city and beyond just the U.S. And I think that's something sort of magical about how it's taken decades to get there and build it up. And I think it's something that we need to, in Atlanta, find ways to continue to market it and talk about it in ways, particularly at a time when public health is having a lot of challenges from a trust and sort of communication standpoint. It's how do we rally around the organizations that are here today and others that are in Atlanta to continue to build on really helping to push the public health issue forward in the global space.
You said something earlier on around the fact that global health cannot be done in isolation, and that's totally true. So partnerships are really at the heart of global health. And for us, these partnerships really elevate the importance of global health because we couldn't achieve the impact, and collectively we are able to achieve that impact and address the needs of populations around the world because of the partnerships that we are able to form here. I mean, we have live examples with partnerships that we've had with CDC and CDC Foundation, never mind the difference between the two. And through these partnerships, we've had great work. Just the last 5 years alone, we've had projects in Poland, we've had projects in Uganda, South Sudan, reaching over 350 million people in those countries. And this is because of the partnerships that we have. We've had, connections with Carter Center. And look at this panel alone. Just the fact that we are here together talking about global health is a testament to the fact that we've got to do this together. As Brandon said, we have institutions in Atlanta. We have the academic institutions. We have research institutions that we've partnered with. We also have the internship and recruitment connections with institutions like Emory and Georgia State University, and they help us recruit some of the next generation global health experts who are also committed to our values, and that's so important. and we do the work that we do and achieve the impact because of some of these connections. And one of the other things I would like to highlight, the fact that we are in Atlanta and we have access to the Hartsfield-Jackson International Airport is one key factor, because we are able to access the numbers of countries that we access and deploy staff and resources to these countries because we have this connection with this airport and we have access. And so these are really important factors. Private sector partnerships, we shouldn't forget that. And we've had some of those important private sector connections and that bring funding to some of the work that we do. And we need to highlight all of that and the importance of the impact that we are able to make across the globe because of those partnerships in the city. I'll stop there.
I suspect you're all familiar with the idea or the concept in a shopping mall that there's often one or more anchor stores, really important stores like Macy's or something, and a lot of other smaller things can survive because of the foot traffic. I want to acknowledge here that the anchor store for global health community in Atlanta is the U.S. Centers for Disease Control and Prevention, CDC. I cannot overstate how important CDC is to Americans' health, much less global health. And I recently discovered that by looking at a globe I have at home, that the United States is actually on the globe. And so we're part of global health. But fair enough, CDC is funded by US tax dollars to protect the health of Americans. But there is no way to protect the health of Americans and turn a blind eye to global health. We've known this for years. Congressmen and women and senators have known this for years, and it's been said, this is not charity, this is an investment in American health when we protect and build strength around the world to detect diseases and control them at their source. It's a fundamental tenet of the way Congress has supported CDC over the years. It's why CDC has such an important role in global health, given that they're funded primarily by US tax dollars. So I just want to recognize that for all of us, or many of us, being partnered with CDC is a key part of this global health community. They've got incredible technology, incredible experience, incredible relationships all over the world, incredible knowledge of epidemiology and laboratory science and surveillance for diseases. They follow trends better than anyone in the world, and they communicate with people all over the world in multiple languages. It is a gem. And we were chatting a bit beforehand. If you travel around the world and meet people in public health and tell them you're from CDC, the reaction is amazing. To these people, this is a legendary organization. So it's been tough listening to people say things about it that I know from having worked there are not true. But we really want to respect that organization for what it does. And it is an anchor store for the global health community here in town. And many of the things we're able to do, these organizations, is because of our partnerships with CDC and because of all that they represent. And I just wanted to be really clear about that.
Thank you. There obviously have been recent U.S. policy changes, so I'd like to ask each of you to comment on the near and long-term implications of those changes on the work that you do, starting with Kasha.
Yeah, I mean, when
Patrick.
you want to do it? So, thank you. So when President and Mrs. Carter actually established the Carter Center, they did it with the spirit of health being a human right, because that's how Jimmy Carter was. And then there's no health without mental health, and those things are important. Of course, peace programs are very important too. And when you're starting to look at what is or has been the impact of some of the resource implications when you come to public health, they are actually tremendous implications in a negative way. First of all, when we were talking about, Patrick just mentioned about CDC. To me, CDC, and again, when you look around this audience and right here in the panel, myself and Patrick, we are sort of the CDC graduates, if you will. And then there are people in this room who I know and recognize who are either at CDC or had worked at CDC at one point in time. So CDC is considered the mecca of public health, and it's really important because when you go around the globe, yes, we are part of the globe, Patrick, and when you start looking around and looking at the various countries, if you go to Korea has a CDC, not because they just thought they needed to have a CDC, but because they wanted to, replicate what our CDC does over here. If you go to China has a CDC too. If you go to Nigeria has a CDC too. And the reason is, and if you go to India has a CDC now as well. And the reason for doing that is because people respect this organization so much that they want to actually do that. Now, when you start cutting resources, and public health is to protect the health of everybody in all of us. It doesn't matter which state, which organization, which country you belong to. It's about protecting the health of everybody, preventing the diseases, and doing it in a scientific, evidence-based format. And in order to do all that, you have to have resources, you have to have workforce to be able to do that. So when you start looking at WHO, and since I work in neglected tropical diseases, WHO put out a report in April of this year, and in order to tell us what the impact of these funding and resource cuts will be. So all the gains that were contributed towards, when you're looking at the neglected tropical diseases over the past 19 years, which were coming from USAID funds, those investments, that can be reversed because the work is still not done. And they did an estimate, and they said, there are going to be around at that time in April, there were going to be about 47 health campaigns to do mass drug administration with ivermectin or with azithromycin for trachoma. Ivermectin is for road blindness and lymphatic filariasis. And when you are not able to carry out those mass drug administration campaigns, and those campaigns were going to target and prevent these diseases in a population of about 143 million people. So that's not going to get done. So that's one example, at that particular point in time coming out of this report from WHO. And then similarly, when you start thinking about, the NDD programs, they are very cost-effective initiatives. When you start thinking about it, as Patrick was talking about, the Mectazan donation program, which is housed here at the Task Force for Global Health, and we work very closely with the Task Force for Global Health. I sometimes joke with my colleagues that you are our pharmacy, and we basically deliver the drugs and do this work and the implementation. But it's all about partnerships when you start thinking about it. And when one of the calculations that we did, that there is, with these drug donations, the amount of money of these drug donations runs into not millions, but one time we looked at it's more than $12 billion, And this is a calculation that is done from 2011 to now, although the Mectazan program started even before that. So think about the amount of resources that are being put into this, and if you cannot deliver these drugs and carry on those mass drug administration and prevent these diseases, those drugs are going to go out of date, they're going to expire. So that's going to be a wastage. So that's another huge implication. The last thing that I would mention is, since we work on mental health, and when you start looking at the Medicare and Medicare cuts, that actually impacts everything. When you start looking at millions of people who rely on Medicaid, for instance, or Medicare, and if you don't have those resources available, that's going to impact the mental health care as well. And then Medicaid coverage is again, millions of people, and it's the largest source of the health coverage, and any reduction in that is going to leave these people without that coverage. Thank you.
I was telling a story before we got on stage. Early in 2020, right when the COVID pandemic started, one of the last meetings that I attended was actually right down, I don't know where the old task force office, but it's really close. It's walking distance. That way. And it was a group that was focused on data modernization and how to do better data interoperability across public health systems. And all of a sudden people started getting phone calls. And people were going out, they were like, I'm gonna have to go away for a minute, I'm gonna have to be out for 30 minutes, I'll be back. And it was calls coming in from all over the world. And as we're sitting here today and thinking back to this sort of like bookend moment 5 years ago, I'm struck by the importance of the interconnectedness of communities and countries and partners across the world, and how instrumental that is from a policy standpoint to continue to move global health forward. The fact that phones, this was late January, the fact that phones were lighting up and that there was that much interconnection to address an issue that was evolving really rapidly is something that's critically important. And I think the other thing too, and I think something that often I struggle with, how do you deal with the fact that public health often doesn't get noticed until something is going wrong. And there's so much that public health does that it gets right. And how do we do a better job of communicating that, creating narratives around that, communicating what return on investment it is to the people, to the colleagues, to the leaders that make decisions about appropriations and funding is really, really key. And I think that's something that we have to think about, how to improve connecting our narrative of the things that seem very hidden to really compelling stories that help invest in not just the future of public health here in Atlanta, but public health around the world. Because as I think back to those moments, it was in a flash of a second how quickly you could see it was a global issue and how critical that was.
Joyce, as you get ready to answer, I'd like to let the audience know we're going to open up to audience Q&A in just a minute. And so you can step up to this microphone stand right here, and we'll be prepared to allow you to ask your questions. So feel free to start lining up as we have the last two questions and answers.
And that's a very important question, because the impact of these policy changes and funding cuts are immediate, and they're also very profound. And I shall give examples around, just supplies and how to get them to the right places. And you've talked about the connectivity of all of us across the globe. I mean, when it happened, we all felt it, and I think all my panelists will say the same for their organizations. Before all of these policy changes, there were estimates around the huge numbers of people that were dying around the world. 8.4 million people die annually just for lack of access to the right services, getting health services available in the communities in which they live, and that leads to loss in the global economy of about trillions of dollars, as you can imagine, in loss in productivity. Now, question is, when all of these have been experienced now with the changing landscape, those numbers, those figures, they're just going to get worse. And that's the reality, and we all have to think about that. And as Brandon was saying, we are also connected, that we can say these numbers may be coming from low and middle income countries, and therefore some countries may be maybe isolated from the impact. I think the world is coming to a place where we all need to shout on top of our voices and say we are so connected that the impact of these things in one country affect all of us. We've had work done in many countries. I mean, we've got programs in Bangladesh, we had programs in Afghanistan, we had programs in Sudan, we had programs in many places that got their funding cut off. And when that happens, what it meant was that clinics were closing. Investments that we had made in training people and training health workers, training community leaders to support the work that was being done in these communities were all crashing, and many of them have closed down. What that means also is that women and children who accessed these health services are no longer accessing them in the way they should. They are just not available. The services are not available. And that's huge, and that's what we need to think about. Our program in Bangladesh alone have trained and invested in over 50,000 workers And it's all going down the drain, and we shouldn't watch that happen. And so that's the immediate impact of the changes in policy and the funding cuts, and we hope that things can begin to take a different turn soon. And so maybe I'll stop there and hand it over to Patrick.
Very well said. So I'll be brief because I want to have time to hear from all of you too. I'll just say one thing that may not be obvious to the people who aren't in global health is the goal of global health is not to endlessly pay for things in other countries. The goal has always been, at least in my lifetime, to help countries stand up these capacities, develop their own skills, do their own acquisition of the medicines they need, train their own nurses and doctors and epidemiologists, and carry that on behalf of their own people. And the story of global health is one of astonishing success. We have made that happen in a variety of ways. There are countries all over the world now that never had the capacity to recruit and mentor and deploy field epidemiologists that now do that on their own. It's in their own budgets. That's thanks to the investments from CDC and our program in TEFINET, for example. There are many countries now that we helped get started with annual flu campaigns. Now they pay for it and run it themselves, and they're prepared for the next pandemic. They know how to stand up a clinic really quick and deliver vaccines to stop whatever comes next. That's happening. We're not done with the job. For some, we're very close to the end. Thankfully, with polio, we're very close to the end. For many others, country by country, we're eliminating diseases or building capacities that they're taking on. So I want to be fair to those who say we don't want to keep spending at this rate. It's not a crime to ask the question, what's the appropriate rate of expenditure? The tragedy here is the abruptness with which the cut came. Many countries said, if you told us this was going to happen and you gave us 5 years to adapt, we could have done a pretty good job. And it's really in our interest to do so. It's our people that we're protecting. But this happened so suddenly, as Joyce indicated, people are thrown out of work who used to distribute the medicines. Trained people, valuable people, no way to transition, they just go straight onto unemployment. Drugs left in warehouses, programs stopped. People on treatment for TB told, there's no more drugs to treat you. Go back to your community and spread that disease. There's nothing I can do. It's that abruptness that's so painful. The final thing I'll say, the final tragedy of this for our country, in the near term, you mentioned the near term and the far term, is that many fine people have left CDC or were sent away from CDC after years of experience and building up the relationships and the skills that they have. That's a great loss. And at least as great is a loss of trust in CDC. What people have said now is if vaccine recommendations depend on who's got control of Congress, then if CDC tomorrow says this is a vaccine everyone should get, or all children should get, or all teens should get, can we trust them? That's never been a question in my lifetime. CDC was the definitive answer. Now there are other groups you can go to, the American Academy of Pediatrics and others, and they've always been completely consistent with CDC, so it's not like it's hopeless. But it takes a long time to build up trust, and it seems like it could be lost very quickly. So I think it's really urgent that we Americans find a way to get back to the point where we can be sure that the guidance that comes out of CDC is in fact science-based guidance, untainted by politics from either side of the political spectrum. And I think that's something we really need to work on together.
Well, on behalf of the organizers, please join me in thanking our